In the face of a novel pandemic and what some are calling a global health emergency, fear and uncertainty have reached unprecedented heights. For the first time in history, entire countries are on lockdown. World leaders uniting in their efforts to contain a crisis. An eerie and somewhat apocalyptic calm has gripped the world. Jarring images of hospitals in chaos, millions of people worldwide forced to shelter in place, and businesses mandated to close have forced many to wonder how they will support themselves and whether the global economy can handle such strain. No doubt there are more questions than answers, but can we make sense of this new reality? Perhaps by asking the right questions, we can do just that. Welcome, my name is Joshua, and here we are in a new era altogether. There are thousands of things to talk about, perhaps, but it seems pretty obvious that all of those are eclipsed by this current global crisis, and it is a global crisis. And so, while this is not something I was planning on covering, given the global impact of coronavirus, seems prudent to me to address it to some degree. And we want to make very clear, first of all, that many people have been affected by this. Arguably, the whole globe, at least indirectly, is being affected by the virus, and more particularly the response to the virus, which is what we're going to focus on. But we don't want to trivialize what is real, which is, this is a live update from worldometers.info. As you can see, 421,413 cases confirmed so far, approaching 19,000 deaths globally. Right? This is real. We don't want to make light of a real situation. There are families that have been affected by this unfortunate virus, particularly among the elderly, people that have passed away, others that have been near to passing away, and as you can see, 108,000 plus recoveries. But we do want to make it clear that this is real. The coronavirus is a real virus, and people are really being affected by it. So, to avoid anybody hearing what's not being said, let it be reinforced here again. The coronavirus is real. It is affecting people, and you should be aware of that if you're not already. Obviously, there are updates every few minutes as to precautionary measures that can and should be taken. We are living in unprecedented times right now. Italy on lockdown, New York, LA on lockdown, Boris Johnson just announcing the UK is now on lockdown, travel restrictions of the highest that we've ever seen globally. I've talked to people twice my age just to make sure I didn't miss something historically, but nobody can recall anything quite like this ever happening in their lifetime. So, like it or not, we are entering a new era of life, and the way in which we do things will forever be impacted by this season. In one way or another, this is indeed a catalytic time historically. And because it has been declared by President Trump and and others that we are on a war path against the coronavirus. Basically, this is a war on the coronavirus. I thought it was fitting to include that quote from perhaps the most recognized, one of the most recognized wartime generals in world history, General George S. Patton. When in doubt, observe and ask questions. And when certain, observe at length and ask many more questions. Another way of saying, be certain that you're certain. There's no more confusing place than a hastily arrived at certainty. Because once you're certain, you tend to stop asking questions. So be certain that you're certain. Once you're certain, observe at length and ask even more questions. Make sure that this was not a hastily arrived at certainty. And we just want to navigate through this confusing time. Many people have lost their jobs. Millions of people are out of work right now, wondering how they're going to pay their bills, scared of impending doom in terms of sickness. There's a lot of confusion and a lot of fear swelling globally. And again, when such unprecedented measures as locking down a nation and restricting travel and ordering sheltering in place come along, it's hard not to be jarred by that. In fact, it would be odd if you weren't naturally scared by such orders, right? And unfortunately, fear, or other emotions, but certainly fear, these emotions tend to be the foe of reason. And nothing stifles critical thinking quite like fear, which is precisely the reason that elite law enforcement agencies or military organizations such as the Army Rangers, the Navy SEALs, and so forth will train ad nauseum for certain high-stress scenarios, and they will have contingency upon contingency. The Secret Service would be another organization. They train for situations that may even seem unrealistic. But by preparing for situations that, if not prepared for, would catch you so off guard and put you into such a high-stress state, they have reasoned through these scenarios while they have their wits about them, trained at such length that when such a situation might arise, they are prepared for it and will respond with their training, which took place in a well-measured environment. Because when foisted into a chaotic situation, people do not tend to respond reasonably. Emotion takes over, and when people panic, they do unreasonable things. There's a reason that training is so extensive in these elite groups, and it is to avoid panicking in a high-stress environment. So what we want to do, ideally, is to be as objective as possible, to, as best we can, strip away as many emotional proclivities here, and look at the numbers, look at the statistics, look at the historical precedents, and so forth. Not trivializing what is, but trying to make sense of what's going on and ask all the more questions. There are people such as Peter Hitchens and some others have written articles recently asking whether or not our response to the coronavirus is the best response. Because undeniably, we are facing some economic turmoil as a result. I mean, they're talking about a $2.5 trillion stimulus package in the United States alone. Questions about whether or not our global economy can sustain such prolonged periods of inaction. Okay. So we want to weigh the threat and the response. And sometimes the best way to do that is to evaluate other threats similar or worse or close in the past and how we've responded to those. So again, we don't want to trivialize people that have suffered as a result of the coronavirus. And we also don't want to become unnecessarily hysterical. And in order to evaluate this, it's very difficult when every 3 minutes you're hearing a news update. Now listen, habitual and targeted reporting does not alter statistics, but it does alter perception. If you heard an update about how many people died of heart disease every 10 minutes, you'd probably change your diet immediately. It's a jarring statistic. If you had an update every 10 minutes about how many people died of cancer, you'd be a little worried. And so the way in which you report something can alter your perception of it. So we want to look at this as objectively as possible, not denying what is, not jumping into needless and baseless conspiracy theories, but also navigating reasonably through published statistics from the Centers for Disease Control, the World Health Organization, and various experts. We're going to appeal to the source material because a lot of people are worried, and understandably so. The globe is being affected, like it or not. Our response to this coronavirus at this point is a fait accompli. We are living in a new era, whether you like it or not. Fear is on the rise. Worry is on the rise. And you can scarcely blame someone for that, given the near complete. I mean, the internet is almost every article, everything, including this, is coronavirus related. The entire globe is preoccupied with this. Okay? So given the global impact of this, I want to just reason through what we know. So we'll start here. Worldwide, 18,810 deaths. And yes, I've just refreshed all of these pages within the last 2 minutes. So this is as of March 24th at 7:10 p.m. my time. This is the current tally, okay? So this is what we're dealing with. The first reported case, I believe when China first reported this to the World Health Organization, was December 31st. And the first death was reported at the end of January. Okay, so this is what we're dealing with globally. Over 400,000 cases, over 18,000 deaths, and perhaps thousands of news reports in the last month, almost exclusively. Nothing else is really being talked about that isn't related somehow to the coronavirus. So there's just no way to get this out of your mind. So the best we can do is try to make sense of it, try to reason through it, because if you don't reason through it, fear will grip you and you'll tend to think emotionally. Don't do that. We want to be reasonable. And if there's a good reason to be afraid of something, well, then evaluate that accordingly. And to some degree that's true, but perspective alters the way you see things. Again, if the perspective is I'm only hearing about how many new cases and how many new deaths there are every 5 minutes, well, that's pretty scary. But if we can perhaps garner some perspective and ask the right questions, and that's really the goal here. I don't see journalists asking many pertinent questions I don't see real unbiased journalistic integrity in the form of trenchant cross-examination for the sake of getting at objective truth. I don't see a lot of that. I see everybody kind of just being led down the path of, oh no, right? Worst case scenario, oh no. Is that warranted? Is our response justified? There's no question we're living in unprecedented times. The question is our response warranted? Is it justified? Does it make sense in light of what happens on a yearly and daily basis? Well, let's start here. World Health Organization. And you can see all the website, the web addresses are up here. World Health Organization, all right? Up to 650,000 people die of respiratory diseases linked to seasonal flu each year. That's a high number. 650,000 people every year, according to the World Health Organization. That's a massive number, okay? Every year, that's how many people die of respiratory diseases each year. So far, there have been 18,800 deaths of coronavirus worldwide. We don't want to trivialize that, but we do want to put it into perspective. Because as it stands, this is hardly on a trajectory to reach or much less surpass 650,000 people worldwide. And I'll show you how we know that relatively conclusively in just a moment. But bear this in mind. Already you can see that large-scale deaths as a result of influenza is nothing new. This was published in December of 2017. According to the World Health Organization, that's a massive number. And you'll hear, well, this isn't the flu. This is nothing like the flu. Well, yeah, technically, you're right. The coronavirus is not influenza. Okay? There are, I believe, 7 different coronaviruses that commonly affect people, including MERS and SARS and this new, what is it, SARS-CoV-2, I think it's called, the coronavirus. That is not H1N1 or H3N2. That's true, but they share many similar characteristics, many. And that's not according to me. That's according to Dr. Fauci, who is the world's foremost expert on the coronavirus, and we'll be hearing from him shortly. Okay, so you're not going to get my opinions here. I'm just going to take you to the sources and reason with me through these things. 650,000 people die of respiratory diseases related to the seasonal flu each year. Okay. Here's what the flu looks like, the seasonal flu, okay? From 1982 through 2017, these are the peak flu activity months, right here. From October to March, but primarily it's December to March. The overwhelming majority of illnesses, hospitalizations, and deaths from seasonal flu occur in a 4-month period, December through March. The overwhelming majority. It's called the flu season for a reason. You don't see many cases in May and June. You just don't. There's a season, and it happens during the winter months, primarily December through March. This is according to the Centers for Disease Control. Not my opinion. This is their graph, not mine. Okay? So the overwhelming majority of flu deaths every year occur within this 4-month period. Okay? Here is estimated deaths in the United States from influenza by season. Starting down here, the 2010-2011 season, all the way through the 2017-2018 season. The big gray part of the pyramid is the number of illnesses total. The maroon color of the pyramid is the hospitalizations, and the beige portion at the top are the deaths. As you can see, 21 million illnesses here, 9.3 million, 34 million. Oops, let's make that larger again, sorry. 34 30 million, 30 million, 24 million, 20 million, 45 million illnesses. This is the United States alone, not the globe, just in the United States. And as you can see, the death toll back in 2010, 37,000 people died, primarily in that 4-month period from December to March. Remember the graph from the Centers for Disease Control. 12,000 people died in the 2011-2012 season, 43,000, 38,000, 51,000, 23,000, 38,000, and 61,000 deaths in the 2017-2018 season in America alone, primarily within a 4-month period of time. Conservatively estimating, that would bring us to an average of, in the 2017-2018 season, okay, just 2 years ago, an average of 15,000 Americans were dying every month. Average of 15,000 Americans died every single month. Don't take my word for it. This was being reported quite frequently. This is the Stranger. Here's their report in February of 2018. The flu is killing 4,000 Americans a week. What's 4 times 4? It's 16. I gave you a conservative estimate, 15,000. There's 4 weeks in a month. Okay. Fortune magazine by Bloomberg here, February 10th, 2018 at 7:53 a.m. Eastern Time. The flu is killing up to 4,000 Americans a week. Already, you should be asking yourself, wait a second, that's a huge number. 4,000 Americans a week? Do you remember this statistic? Do you remember the entire U.S. economy being shut down, the NBA suspending its season, bars and restaurants closing down when 4,000 Americans were dying every week? Do you remember that? You might remember the 2017-2018 season being particularly bad and a push for you to get a flu shot. But do you remember that 4,000 Americans were dying every week? So the first question must be, why is it that we are more concerned and more hysterical right now about the coronavirus when 2 years ago 4,000 Americans were dying every week? Let's put this in perspective. All right, remember our numbers here. Total deaths. Now, mind you, that 4,000 total. This was in the peak months, right? And especially in February, 4,000 a week. So the total deaths in the United States right now, 18,000, or sorry, in the world for coronavirus, total world deaths. Oops, tab just crashed. Total world deaths, 18,887. Total deaths in the world from coronavirus. In 2018, 4,000 Americans were dying every week. Every week. So, in just about 5 weeks, just over a month, right? Just over a month, roughly the same time the coronavirus has been since the first death was reported, the same amount of Americans died in America alone as have died worldwide from the coronavirus. Understand this perspective. American population comprises approximately 4.4% of the global population, a very small percentage. Understand that. And I think a lot of people fail to understand global population ratios. We throw big numbers around thinking we understand what they mean, and we really don't. Okay, the world population right now is about 7.8 billion. You might think you understand how big that number is, but you probably don't. All right? For example, 1 billion seconds. If you were to count to 1 billion, it would take you approximately 30 years. So do the math on this. If one person was born every second from the time the Declaration of Independence was signed until now, you'd have roughly the world population. That's how many seconds have transpired from the signing of the Declaration of Independence until now. Approximately 7.8 billion seconds. It's a lot of seconds. That's a lot of people. We don't want to trivialize 18,000 deaths, but we do want to put that in perspective. Because 18 in the scope of 7.8 billion is a relatively small number. How do we know that? Well, because the World Health Organization tells us up to 650,000 people die of the flu each year. And I bet you didn't know that statistic either. Have you ever seen a news report on that? Have you ever been overwhelmed and panic-stricken at the notion that over 500,000 people die from the flu every year? Perspective. Perspective matters. Okay. 4,000 Americans dying from the flu every week. Every week, just 2 years ago. And total American deaths in a month from coronavirus, 775. That's where we're at right now. Total deaths. 775 in a month from this novel virus that has no vaccine versus 2 years ago when a couple of strains of flu were going around for which there was at least one vaccine. And 4,000 Americans every week were dying in a month, not even 1,000 from coronavirus. Does the response seem disproportionately hysterical given these numbers? These aren't my numbers. You need to ask yourself, why are we responding this radically when nobody seemed to bat an eyelash 2 years ago when 4,000 Americans were dying every week? That's a good question. You'll say, no, Josh, you don't understand. This is going to be even worse. It's going to grow. It's going to get worse. As Dr. Fauci says, it's the Wayne Gretzky model. You want to be where the puck is going to be, not where the puck is now. You want to get ahead of it because wherever you think you are, it's worse than that. Okay, we'll get there. 4,000 Americans every week were dying 2 years ago, and nobody seemed to care. Perspective. Observe at length and ask even more questions. Here is a 2017-2018 report from the CDC. Estimated influenza illnesses, medical visits, etc. Here they said in that same high season, 21 million influenza-associated medical visits, 810,000 influenza-related hospitalizations, and 61,000 associated deaths. Okay, this is their report. Now, I want you to notice something right away. The CDC's reports vary, and they change. Okay, here's their report from 2018, September of 2018. Right, the peak of the flu season was in February. That September, several months later, this was their report. The CDC, right down here, early estimates indicate that more than 900,000 people were hospitalized and more than 80,000 people died from the flu last season. So in September, they reported an estimation of more than 80,000 people. But just a little bit later, the figure changed to 61,000. It's a difference of 19,000, which was not lost on the CDC. They addressed this. Can you explain why the estimates on this page are different from previously published and reported estimates for the 2017-2018 season? For example, total flu-related deaths during the 2017-18 season was previously estimated to be 79,000, but the current estimate is 61,000. That's a massive margin of error. So they say the estimates on this page have been updated from an earlier report published in December, which we just read, based on more recently available information. There's a trade-off between timelines and accuracy of the burden estimate. So as you can see, historically speaking, undeniably speaking, from the Centers for Disease Control own website, early estimates are simply not reliable. In this case, to the tune of a difference of 19,000. They overestimated by 19,000. That's a lot. That's a lot of overestimated deaths attributable to the flu. So a couple years later, new data suggests They were off by quite a bit. So they altered the statistic. So early reports aren't necessarily reliable. As they say, based on more recently available information. From 80,000 to 61,000, the CDC's reports can vary. And they looked more ominous initially than they eventually were. But even taking their conservative and more recent and presumably more accurate statistic of 61,000, that's still an average of 15,000 Americans dead every week, and I bet you never heard a news story about it. Or if you did, you forgot it shortly after you heard it. 15,000 a month average. 4,000 a week. The coronavirus isn't even close to being close to that number. So when people say, well, the coronavirus isn't just the flu, you're right. Statistically and provably, as it stands right now, the flu is much worse. Statistically and provably, until or unless something actually changes, not hypothetically changes, not what could be, if, maybe, when, no. What is right now, statistically available, the flu is provably worse. And you'll say, wait a second. Nope, what about that 1% mortality rate? Because we know, we've been hearing it ad nauseum, this coronavirus has a 1% mortality rate compared to the flu's 0.1%. It's 10 times the mortality rate of the flu. We'll get there. Just travel with me. I want to reason through. These aren't my websites. This is the CDC. This is the World Health Organization. Commonly reported statistics on the flu. From 80,000 to 60,000, the stats changed. Okay, this year, this is the weekly U.S. influenza surveillance report from the Centers for Disease Control. Okay, this year, so far, the most commonly reported virus this season is H1N1. Remember that? Remember the swine flu? That's just common now. That's just the most common strain of the flu we're dealing with this year. Here we go. CDC estimates so far this season there have been at least 38 million flu illnesses. This is in the United States alone. Okay, the United States alone. 390,000 hospitalizations and 23,000 deaths from flu. The CDC estimates this year alone, up until, it says right here, March 14th, ending March 14th, that there have been 390,000 hospitalizations in the United States. Now, let's take you back to the coronavirus global statistic. There have been 422,000 global cases confirmed. In the United States alone, we've had just slightly less hospitalizations from the flu. And the total illnesses, at least 38 million flu illnesses in the United States. 23,000 people this year, estimated by the CDC, have died. And again, according to their own graphs here, we know that primarily that number comes from 4 months, from December through March, primarily. That's the peak of the flu season. 23,000 deaths just this year alone. What has the United States seen from the coronavirus? 775. So the seasonal flu primarily kicked up about a month. It's got about a month head start on the coronavirus. As you can see, the coronavirus isn't even close to being close to what the seasonal flu has already done this year, according to the Centers for Disease Control. Not even close to being close. 775 to 23,000, even adjusting for being a month behind. even adjusting for being 2 months behind, this number is not on a trajectory even to 23,000. How do we know that? Dr. Fauci is going to explain how we know that. You can look at Washington State, where there's no new reported cases. Where the coronavirus first broke out in the United States, there are no new reported cases, much less new reported deaths. It went up, and then it went down. Let's continue. CDC estimates that influenza has resulted in between 9 million and 45 million illnesses. That's a massive spread. Between 140,000 and 810,000 hospitalizations, between 12,000 and 61,000 deaths annually since 2010. All of this to say, the flu is very unpredictable. So just when you want to say, no, we know what the flu does, that's why the coronavirus is a greater threat. No, you don't know what the flu does. Between 12,000 and 61,000 deaths is a massive spread. That's a massive margin. And as we can see, one year there were 12,000 deaths. The very next year, 43,000 deaths. 30,000 people more died the following year. That's not very predictable, is it? Again, 23,000 to 36,000 to 61, or sorry, is that 38? 38,000 to 61,000. Over 20,000 more deaths from the 16-17 season to the 17-18 season. Hardly what I would call predictable. And so far, statistically, these numbers are vastly more concerning than what we're seeing currently from the coronavirus. Only you're not getting an update every 10 minutes. The numbers don't lie. 9.3 million to 45 million illnesses each year. That's the spread. That's a massive difference. 36 million people, that's the margin of error. 36 million illnesses, huge margin of error. As you can see, the flu can be unpredictable. Sometimes the predominant flu strain, as this year is H1N1, the vaccine that they release might not be the one that is designed to target the predominant flu strain that year. This happens routinely. They'll say, get a flu shot. Oh, well, and then when they find out what the predominant flu strain is, turns out the vaccine we have isn't the one for that one, and it's treating the lesser flu strain that year. So we don't know. The flu is quite unpredictable and kills up to 650,000 people every year. Okay. Now let's look at the two states that are most impacting the United States, California and New York specifically. Okay. California and New York. New York is now being touted as the new epicenter of the coronavirus, and more people are certainly being affected in New York than any other state currently. Okay. Right now, you can see that New York has 53 new deaths, 4,700 new cases, right? It's a lot of new cases. And California has over 400 new cases and 11 new deaths, right? Both of these states have I think, shelter-in-place orders. Everything's basically shut down in both of those states. Okay. This is 2017 from the Centers for Disease Control. The New York leading cause of death, 2017. Number 6 on the list is flu and pneumonia. Flu and pneumonia accounted for 4,500 deaths in New York in the year of 2017. 4,500 people died of the flu. And again, that's primarily within those 4 months, December to March, which means an average of about 1,000 New Yorkers every month were dying of the flu in 2017. In California, the average is about 1,500. As you can see, number 8 on the list of leading causes of death in California in 2017, influenza pneumonia. A total of 6,300 Californians died in 2017. Again, primarily within those 4 months, the overwhelming majority from December to March. It's and rounding down, it's about 1,500 Californians every month. And this last month from coronavirus, New York has seen a total of 210. That's 1/5 of their average flu death rate in 2017. 1/5. In California, they've seen 51. 51 total deaths in California, and the entire state is shut down. When in 2017, they were seeing an average of 1,500 deaths from the flu, business as usual. Does it seem like perhaps the response is disproportionately hysterical? I'm asking a question here. And you'll say, no, but it's going to get worse. Look at Italy. Let's look at Italy together. There's just no denying Italy is going through a really hard time right now, and we don't want to trivialize that. 69,000 cases of coronavirus. Nearly 7,000 people have died in Italy. All right, 6,800 Italians. Indeed, this is quite tragic. So here's Italy. Well, I'm going to take you to the International Journal of Infectious Diseases, Volume 88, November 2019, pages 127 to 134. An investigation from the 2013-14 flu season through the 2016-17 flu season, investigating the impact of influenza on excess mortality in all ages in Italy during recent seasons. Why did they conduct this study? Okay. Let's read their objectives first. In recent years, Italy has been registering peaks in death rates, particularly among the elderly during the winter season. Influenza epidemics have been indicated as one of the potential determinants of such an excess. The objective of our study was to estimate the influenza attributable contribution to excess mortality during the influenza seasons from the aforementioned dates. Now, again, these are, look at, during the winter season, because that's when the flu tends to come about. It is during the winter season. Very, very few flu cases in the summer. Nearly unheard of. The flu comes around during the winter seasons. It's called the flu season for a reason. But they were noticing peak death rates, particularly among the elderly. So they set out to study what could be accounting for this. Here's what they found. In the winter seasons, from those 4 flu seasons, an estimated average of 5.29 million influenza-like illnesses occurred in Italy, corresponding to an incidence of 9%. More than 68,000 deaths attributable to the flu epidemics were estimated in the study period, and Italy, listen to this, showed a higher influenza-attributable excess mortality compared to other European countries, especially in the elderly. Not a new problem for Italy. Higher excess mortality attributable to the flu than other European countries, and especially among the elderly. Why is that? Well, many people have sought to make sense of this, but Italy has a higher elderly population, for one. Their standard and method of living, their greetings, there are many things that could factor into this. The fact is, this is not a new problem. Italy has had a problem with elderly people dying at a higher rate than any other European country from the flu, so much so that they sent a team to study this back in 2013. Here's what they found. We estimated the excess deaths of, I'm going to just round to the nearest whole thousand here, 7,000, 20,000, 16,000, and 25,000 attributable to influenza epidemics in the respective seasons. So notice that in the 2016-2017 season in Italy, approximately 25,000 deaths were attributed to flu epidemic. giving them a generous 5-month, an extended flu season of 5 months. That's an average of 5,000 Italians a month. 5,000 a month. Not a new problem for Italy. That was just a couple years ago. The 2016-2017 season. 3 years ago, Italy on average was losing about 5,000 people a month to the flu. Now, 6,800 is a lot. The point is, they've noticed a problem in Italy for quite some time, registering higher mortality rates than any other European country. But why don't we hear from the expert, perhaps the expert, Dr. Fauci, who is advising the White House and so forth. He is basically Mr. Coronavirus. Okay? Now we're going to listen to what he has to say and compare his words to his words. Not my ideas, not my speculation. Let's listen to Dr. Fauci.
My first question for you is what you said a bit earlier today. You said we're looking at least several weeks at this current trend. You're studying trends from all over the country. Why did you put that timeline on it, sir?
Well, if you look at the curve of the outbreaks in places that we now have experienced, unfortunate experiences, look at China, look at what happened in South Korea, look at what's happening in Italy, you see that the outbreak putters along and then it goes way up, peaks, and then comes down. The height of the peak and the duration is obviously influenced by the things you do to mitigate it, the kinds of things that we're doing right now, physical separation of people. But if you take a look at a typical duration of an outbreak, it's measured in a few weeks. I mean, the China one was about 6 or 8 weeks before it was really way down. Others are maybe a little bit less, 4 to 6 weeks. But it's certainly, if you want to say when from the time you know you're starting to see cases, community spread, to the time you peak, there's no question when you look at the various models, that is going to be a few weeks.
I've got a specific...
Okay. Let's stop there. So I said it's going to be a few weeks, and we know this from looking at China, South Korea, at least a few weeks. Okay. That is, not only is it not inconsistent with the standard flu season, it's actually significantly less. Because the standard flu season is, the peak months is for a register of 16 weeks. And he says, with the coronavirus, he says it kind of putters along, and then all of a sudden it goes up, and then it peaks for a while, and then it goes down. Just like the seasonal flu. Not many people are getting sick in October and November, a few. And then all of a sudden in December, people start getting sick. Here's a flu chart from the 2019-2020 flu season. Okay? You can see, by week 50, right around December, the cases start doubling. And then they double again. There was a new report today from New York saying, well, the cases doubled. Coronavirus cases doubled. Well, this is not unlike the seasonal flu. Cases double from week to week. Here we go. You can see the 50th week to the 51st week, they about doubled. And then again, they doubled again. And then they went down a little bit, and then it started going back up. And by the 8th week of the new year and the 9th week, we're peaking in around February. It starts going down in March. This is exactly what Dr. Fauci just described with the coronavirus. He says it's going to be about a few weeks. The entire global economy is shutting down for a projection of a few weeks out of his own mouth. A few weeks. And he says we can look to China and South Korea for evidence of this. Okay? And we're going to do that. But I want you to hear what he said. This is either the same day or these were at least published the same day. This was published March 20th, 2020 on Fox News. On the same day published, March 20th, 2020, down here on PBS NewsHour. Here's what he said. He's wearing a different tie, but his blazer and his shirt are the same, so conceivably this is the same day. I don't see why they, given the state of affairs, why they would wait a prolonged period to post this video. There's every reason to believe he did these interviews the same day and they published them on the same day. With pressing news such as this, why would they wait another day? All right, so there's every conceivable reason to believe that he did these interviews on the same day. All right, he said it's going to be a few weeks. We can look at what happened in China and South Korea. They went up and then they've already gone down. That's what he said to Fox News. Here's what he said to PBS NewsHour.
What is your biggest concern about this coronavirus pandemic?
Well, I mean, my biggest concern, I think, would be obvious because we've seen its potential. We see what it did in China. We see what it has done in Korea, and we see what it's doing right now in European countries, particularly Italy and France. We have an escalation of cases in our own country right now. And my concern is, and I hope it goes from a concern to a realization that we're doing what we should be doing.
Okay. He's concerned about the potential of this virus because of what we've seen. And he cites China and South Korea again, and then some European countries. He said, we've seen what it's done in China and South Korea. Now, again, just to note, you can see he's got the gray blazer and the blue shirt, and that's a dark blue tie. Here, he's got the gray blazer and the blue shirt and a spotted tie. So, but these were published on the same day. Looks like he changed his tie. No reason to believe that these interviews were not conducted on the same day. So he says he's concerned about this because of the potential. And he references, look what it did to China, look what it did to South Korea. In this interview with Fox News, he says, well, we can already see that it's only going to last a few weeks because that's what happened in China and that's what happened in South Korea. Wait a second. You can't have it both ways. But if we need some further illumination on this point, listen to his conclusion.
Direction on that date?
You know, I can't predict what the situation would be. I think we need to be prepared to modify behavior even when it involves things that are very close to our heart.
Okay, so if that's the case then, how do we know when? We're turning the corner, Doctor?
Well, you know, when you start to see things turn around, I mean, you mentioned the Korea curve. I mean, the China curve has already gone up and down. There are fewer cases per day in China than most places that we're dealing with. In Korea, it went up and just started to turn down and flatten out. Once you see that you're going the other direction, then you know you're turning the corner.
Once you see you're going the other direction, then you know you're turning the corner. I sure hope so. A profound statement from Dr. Fauci. This is absurd. Quite frankly, what he's saying is absurd. On the one hand, at Fox News, he says, we've already seen China went up and then it went down. We've already seen them turning the corner in just a few weeks. They're reporting fewer cases than anybody else. Over here at PBS NewsHour, he says he's concerned because of what we've seen happen in China. Well, according to him, China is supposed to be a source of hope, and North Korea a source of hope. We've already seen them on the downturn within just a few weeks. Now let's look at what's happened in China. Okay, 3,200 deaths, 81,000 total cases, nothing to balk at. Yes, this is still a concern. But as he said, let's look at the graphs. Now, some people have said, well, we don't know if we can trust these numbers because the Chinese aren't in the habit of truth-telling. Yeah, perhaps, but the same expert and advisor to the White House seems to think these numbers are reliable. So if we're going to believe him about anything else, we also have to believe him about this. He thinks these statistics coming out of China are reliable. So we'll just use his words and his standards. Follow me here. What we see in China was a rise, and it went down, and then it spiked all of a sudden on February 12th, and then it started dropping again and dropping. And as he says, fewer reported cases in China than anywhere else. Right? People have still died in China, but at a much lower rate. Only 7 yesterday. Versus, you can see the trend. Now again, look at this graph. it is not dissimilar to the standard flu season graph. In fact, it's a much shorter period of time. This is from the end of January to the end of March. That's 8 weeks compared to the flu season standard 16 weeks. So according to this graph, that's about half the time of the standard flu season, with a total death rate in China, or total death toll of 3,200. Primarily coming out of Wuhan, China, which has a population of 11 million. What about South Korea? 120 deaths total. Now remember, he said to the PBS NewsHour woman, he's concerned about the potential of this virus because of what it did in South Korea.
Its potential. We see what it did in China. We see what it has done in Korea, and we see...
Hold on. We see what it has done in Korea. That's what he said. We see what it's done in Korea. This is why he's concerned. Well, we don't want to make light of what's happened in Korea, but so far 120 people have died in Korea. Here are their daily cases. End of February, they start going up, right? March 3rd, they're still going up, drop down a little bit, and then they dissipate quite radically, and they're going down and down and down. So this is what it's done in Korea. Some people have been sick to the tune of 9,000, and 120 people total have died. And I want you to compare that Korean statistic in a month to America's 4,000 a week flu deaths 2 years ago. So how is it that Dr. Fauci is concerned about the same thing he's using as a sign of hope, saying it's only going to last a few weeks? We know that because of what happened in China and Korea, the Korean curve, the China curve. It goes up and then it goes down. A few more weeks and it's going to go down. Yet he tells PBS NewsHour he's concerned because of what it's done in China and what it's done in Korea. Well, what it's done in China and what it's done in Korea, according to the same man, is it's coming to a halt. There are fewer reported cases in China and Korea. That's what it's doing. And in a short amount of time, in about half the time a standard flu season runs. Already, what he's saying, it does not comport. He's speaking out of both sides of his mouth. This is the foremost expert on the coronavirus in the world, advising the White House, saying that the same thing we can look to as a source of hope is his concern. You can't have it both ways. Now, again, we don't want to trivialize 120 deaths in South Korea, but quite frankly, in comparison to the flu every year, that number is radically small. We can look at the new deaths in the United States, new deaths reported in 5 states. 45 states report no new deaths at all. Now, he mentioned Washington to one of those ones. We can look at what happened in Washington. Well, let's look at Washington. Here's Washington, where it all started. A total of 110 people died in Washington. They have no new reported cases, much less new deaths. As of right now, Washington is capped at 110 people died of coronavirus. No more new cases, no more new deaths. If you don't trust the China statistic, certainly you must trust the Washington statistic. The CDC must be verifying the statistic, right? And Fauci cites it. So what's going on in Washington? Well, the place where it all started, it's all stopped. No new cases, no new deaths. All in a matter of a few weeks. So why is America shutting down? That's a good question. That's a really good question to which I wish I had a good answer. Washington, not unlike California and New York in 2017, sees the flu/pneumonia as the number 9 cause of death. Total deaths in Washington in 2017 was 1,000. 1,000 people died primarily in that 4-month period. 1,000 people died during the flu season in Washington. Of coronavirus, 110, and it appears that no more are dying. And since fewer cases are being reported, if there are any lingering cases and subsequent deaths, it will be a small number added on to that. So as of right now, 10 times as many people died of the flu. But you say, wait a second, the flu has a mortality rate 10 times lower than the coronavirus. It's a 10 times higher mortality rate. We're getting there. Just bear with me. Here's what else he says. Now, I want you to listen to the question from the 60 Minutes interviewer. The question begins with, what does your belly tell you?
What's your belly tell you about where we will be in about a year?
Please listen to that again. This is the lack of integrity in journalism. What's your belly tell you? Not what does reason tell you? Not what does a well-measured projection with adequate precedent tell you? And here's why. What does your belly tell you? That's the question to Dr. Fauci.
What's your belly tell you about where we will be in about a year?
I don't think we've seen the worst yet. I think we'll still continue to see more infection.
I don't think. This is not a certainty. I don't think we've seen the worst yet.
I hope by next year at this time, we will have gone through a cycle and we don't have a second season of it. And if
I don't think, and I hope. So far, Dr. Fauci is offering his thoughts and his hopes. And this appears to be, well, no, he's just wearing the same outfit.
If we do, hopefully we have a vaccine that might be able to help with public health measures to mitigate the impact.
Could we be helped by the fact that this virus tends to like cold and dry, and it doesn't like warm and moist?
We could. Respiratory viruses in general, the concept of a respiratory-borne...
We could, he says. There's no certainty here. Yeah, we could. Yeah, we could be helped by that fact. He doesn't deny. Listen.
Illness like influenza or other cold viruses, even coronaviruses, tend to diminish as you get into the warmer weather for a number of reasons. People tend to stay outside more as opposed to closed spaces. The virus itself doesn't like warm, moist as much as it likes cold, dry. So that it is conceivable on principle alone that that could happen. But there's no guarantee that this particular coronavirus is going to diminish when the weather gets warmer. But I hope it does, but we can't guarantee it.
He hopes it does, but you can't guarantee it. Well, by that measure, you can't guarantee that it won't. He says, well, we can't guarantee that it's going to go out with the summer. Well, then you couldn't possibly guarantee that it's going to persist at a constant rate, which seems to be the fill-in-the-blank fear that is permeating the global atmosphere. They seem to be allowing people to kind of fill in the blank as we go. They show you how many new cases there are every 10 minutes. And they say, well, you know, it could be horrible. It could be really bad. Who knows how long it's going to go? Well, if you don't know how long it's going to go, how can you say that it's not going to end in the summer? He says, well, yeah, it could. I hope it does, but we don't know for sure. Well, then, by definition, you don't know for sure that it's going to persist. So you're going to shut down the global economy on the basis of your belly? What does your belly tell you? That's what 60 Minutes asked this man. What his belly told him. Now, he says, yeah, it's true. Cold, even other coronaviruses tend to not thrive in the summer. Well, what do you know? That's not unsurprising given everything we know about these other illnesses. Yes, they come around during the winter months and then they taper off when it starts getting warmer. And he concedes, yeah, the coronavirus is like that as well. But we don't know that it's going to end. You know, I hope it does, but we don't know for sure. Well, there's not a good reason to believe that it's not. If other coronaviruses show a history of not thriving in warm months and coming about during the standard flu season, when influenza is also thriving, then there's every reason based on precedent to believe that this coronavirus will respond similarly to others. He says, yeah, but we don't know for sure. Well, then you don't know for sure that it's going to continue. So we're going to start shutting down the entire economy because your belly tells you maybe, maybe not, I hope, I think. These are hopes and thoughts. This is not a statistical analysis, much less a good question from the 60 Minutes journalist. So here's all the estimates you could see on CDC, 23,000, 51,000, right? But you say, Josh, wait a second. What about that 1% mortality rate? It's much higher. Now, first of all, let me just say this. The mortality rate does not translate to net damage. For example, follow me here. The mortality rate for jumping off of a 100-story building is 100%. That does not translate to affecting a net larger portion of the population. It's a higher mortality rate than a lot of other things. 100%. Gosh, how many things have a 100% mortality rate? Well, jumping off a 100-story building, I'm not aware of a single case of a person surviving a jump like that. So it's reasonable to assume this is a 100% mortality rate. That does not mean that it has a net effect, a net total loss greater than something else. Just because the mortality rate is higher doesn't mean it affects more people. So that's not a massive concern. Even though it has a high mortality rate, it doesn't correspond to affecting a larger portion of the population. But we're going to read an article here from John P.A. Ioannidis, whose article is titled "A Fiasco in the Making as the Coronavirus Pandemic Takes Hold. We are making decisions without reliable data." Now, before we read this, I want to read his credentials, okay? About the author. John Ioannidis is professor of medicine, professor of epidemiology and population health, professor of biomedical data science, and professor of statistics at Stanford University, and co-director of Stanford's Meta Research Innovation Center. Okay? Medicine, epidemiology, and population health, biomedical data science, and statistics. He studies diseases and numbers and researches these things for a living. Meta Research Innovation Center at Stanford. That's who this is. Don't take my word for it. Let's listen to Stanford's professor of epidemiology and statistics, who is calling this a potential fiasco in the making. He wrote this article March 17th. Listen. The current coronavirus disease, COVID-19, has been called a once-in-a-century pandemic, but it may also be a once-in-a-century evidence fiasco. Evidence. He's not going on his belly here, 60 Minutes. Evidence. From a statistician at Stanford. Listen. At a time when everyone needs better information, from disease modelers and governments to people quarantine or just social distancing, we lack reliable evidence on how many people have been infected with SARS-CoV-2, aka the coronavirus. Now, I'll remind you of what we read in the CDC. Their 2018 report in estimating United States deaths as more than 80,000 differed from their new data a year or two later, which dropped by 20,000. So you can see he's saying we don't have reliable evidence now, and that is evidenced by the CDC's own report that evidence changes. We lack reliable evidence on how many people have been infected with coronavirus or who continue to become infected. There's a shortage of tests. We couldn't possibly know how many people are infected. There's the big concern is we need more testing, as if tests save people. What's the treatment? The test doesn't alter your status. It may help with data and let you know, oh, you should be safe, as you should be anyway. But the test doesn't help you with the treatment. What's the treatment? It's largely what they do with the flu. Several medical professionals have said, yes, we tell people to go home, to quarantine themselves, to get vitamin C in their system, stay hydrated, and get some rest. That's the treatment, because there is no vaccine. So, we don't have tests to possibly know how many people have been infected or who continue to become infected. Better information is needed to guide decisions and actions of monumental significance and to monitor their impact. Listen, draconian countermeasures have been adopted in many countries. If the pandemic dissipates, either on its own or because of these measures, short-term extreme social distancing and lockdowns may be bearable. How long, though, should measures like these be continued if the pandemic churns across the globe unabated? How can policymakers tell if they're doing more harm than good? That's a great question. Vaccines or affordable treatments take many months or even years to develop and test properly. Given such timelines, the consequences of long-term lockdowns are entirely unknown. This is quite unprecedented indeed. The data collected so far on how many people are infected and how the epidemic is evolving are utterly unreliable. Let me read that again from the professor of statistics at Stanford University. The data collected so far on how many people are infected and how the epidemic is evolving are utterly unreliable. Not just unreliable, utterly unreliable. Given the limited testing to date, some deaths and probably the vast majority of infections due to SARS-CoV-2 are being missed. We don't know if we're failing to capture infections by a factor of 3 or 300. We just don't know. 3 months after the outbreak emerged, most countries, including the United States, lack the ability to test a large number of people, and no countries have reliable data on the prevalence of the virus in a representative random sample of the general population. That's statistics lingo. You need a random representative to a representation, a representative random sample in order to get an idea of how this is affecting everybody. We don't have that. It's not random, and he's going to explain why. This evidence fiasco creates tremendous uncertainty about the risk of dying from COVID-19. Reported case fatality rates, like the official 3.4% from the World Health Organization, cause horror, of course, and are meaningless. Meaningless. Patients who have been tested for SARS-CoV-2 are disproportionately those with severe symptoms and bad outcomes. That's not random. The people, remind you, what's been said from the government, due to a shortage of tests, they've said, unless you have severe symptoms, don't get the test. Save it for those who have severe symptoms. So we're not just testing everybody. We're testing disproportionately those with bad symptoms and those who have bad outcomes. So the graph is skewed, radically skewed. It's not random. And you're not testing everybody. We don't have the test to test everyone. That's why they're saying don't get tested unless you have a severe suspicion that you actually have contracted this. Save the test for those who definitely have it. And mind you, they've also told us a lot of people don't even know they have it. Coronavirus is so bad, you might not even know you have it. I'll tell you what, every time I had the flu, I knew for a fact I had it. I was never in doubt that I was severely ill. Disproportionately those with severe symptoms and bad outcomes. As most health systems have limited testing capacity, selection bias may even worsen in the near future. We already have a shortage of tests. They're already dissuading you unless you have severe symptoms. These numbers couldn't possibly be accurate. They are radically biased, selection bias, okay? That alters your entire perception. Not the data, but your perception of it. Remember what I said. The one situation where an entire closed population was tested was the Diamond Princess cruise ship and its quarantine passengers. The case fatality rate there was 1%. There's that 1%. But this was a largely elderly population in which the death rate from COVID-19 is much higher. For the record, the average age on that ship was 58 years old. 7 people died, and all 7 of them were over 70 years of age. Okay? Who primarily goes on cruises? Retired people, elderly people. This is not an accurate representation of the population. So that 1% statistic is radically skewed. Projecting the Diamond Princess mortality rate onto the age structure of the U.S. population, the death rate among the people infected with COVID-19 would be 0.125%. But since this estimate is based on extremely thin data, there were just 7 deaths among the 700 infected passengers and crew. The real death rate could stretch from 5 times lower, 0.025%, to 5 times higher, 0.625%. It's also possible that some of the passengers who were infected might die later, and that tourists may have different frequencies of chronic diseases, a risk factor for worse outcomes with SARS-CoV-2 infection, coronavirus, than the general population. Adding these extra sources of uncertainty, reasonable estimates for the case-fatality ratio in the general U.S. population vary from 0.05% to 1%. 0.05 is even lower than the seasonal flu, which is 0.1. That's half as much, potentially. Potentially, it's only half the mortality rate of the seasonal flu. This, according to a professor of epidemiology and statistics at Stanford. That huge range markedly affects how severe the pandemic is and what should be done. A population-wide case fatality rate of 0.05% is lower than seasonal influenza. If that is the true rate, locking down the world with potentially tremendous social and financial consequences may be totally irrational. You think? It's like an elephant being attacked by a house cat. Frustrated and trying to avoid the cat, the elephant accidentally jumps off a cliff and dies. Totally irrational. Could the COVID-19 case fatality rate be that low? No, say some, pointing to the high rate in elderly people. However, even some so-called mild or common cold-type coronaviruses that have been known for decades can have case fatality rates as high as 8% when they infect elderly people in nursing homes. In fact, such mild coronaviruses infect tens of millions of people every year and account for 3 to 11% of those hospitalized in the U.S. with lower respiratory infections each winter. These mild coronaviruses may be implicated in several thousands of deaths every year worldwide, though the vast majority of them are not documented with precise testing. Instead, they are lost in the noise among 60 million deaths from various causes every year. Although successful surveillance systems have long existed for influenza, the disease is confirmed by a laboratory in a tiny minority of cases. In the United States, for example, so far this season, 1,073,976 specimens have been tested and 222,552, a total of 20.7%, have tested positive for influenza. In the same period, the estimated number of influenza-like illnesses is between 36 million and 51 million, with an estimated 22,000 to 55,000 flu deaths. Remember, we read from the CDC website, they've estimated 23,000, which is very near the low end of that estimation right there. They've estimated 23,000 deaths this year, just like he said. Note the uncertainty about the influenza-like illness deaths. A 2.5-fold range corresponding to tens of thousands of deaths every year. Some of these deaths are due to influenza and some to other viruses like common cold coronaviruses. Remember, the CDC pyramid we saw, it said from a range of 12,000 to 61,000 deaths a year. A massive range. Even more than 2.5. But here, this year, it's a 2.5-fold range. In an autopsy series that tested for respiratory viruses in specimens from 57 elderly persons who died during the 2016-2017 influenza season, influenza viruses were detected in 18% of the specimens, while any kind of respiratory virus was found in 47%. In some people who die from viral respiratory pathogens, more than one virus is found upon autopsy, and bacteria are often superimposed. A positive test for coronavirus does not mean necessarily that this virus is always primarily responsible for the patient's demise. They could test positive for coronavirus, but it could have been H1N1 that killed them. They could have both. If we assume that a case fatality rate among individuals affected by coronavirus is 0.3% in the general population, a mid-range guess from my Diamond Princess analysis, and that 1% of the U.S. population gets infected, about 3.3 million people, this would translate to about 10,000 deaths. This sounds like a huge number, but it's buried within the noise of the estimate of deaths from influenza-like illness. If we had not known about a new virus out there and had not checked individuals with PCR tests, the number of total deaths to influenza-like illness would not seem unusual this year. At most, we might have casually noted that flu this season seems a bit worse than average. The media coverage would have been less than for an NBA game between the two most indifferent teams. That's about what happened in the 2017-2018 flu season. Remember, the year before, the total deaths in the U.S. was about 38,000. Jumped to 61,000 the next year. And yet, despite that massive jump, 4,000 people a week dying in America alone, what happened? Nobody remembers that statistic. Life went on. Seems like his analogy of the coverage of an NBA game between the two most indifferent teams is pretty apt. What if we had been doing specific targeted testing during that time and found out that there was some novel virus to account for those 30,000 deaths? That 30,000 death increase. 22,000, I guess it was. In any event, a massive amount of more deaths. Would we have shut down the United States then? That's his question. Some worry that the 68 deaths from coronavirus in the U.S. as of March 16th will increase exponentially to 680, 6,800, 68,000, and 680,000, etc., along with similar catastrophic patterns around the globe. Is that a realistic scenario or bad science fiction? How can we tell at what point such a curve might stop? Well, according to Dr. Fauci, we can look to China and South Korea and know conclusively that those curves stop. How about we look to Washington State, where after 110 total deaths, there's no new reported cases or deaths? The most valuable piece of information for answering those questions would be to know the current prevalence of the infection in a random sample of a population and to repeat this exercise at regular time intervals to estimate the incidence of new infections. Sadly, that's information we don't have. In the absence of data, prepare for the worst reasoning leads to extreme measures of social distancing and lockdowns. Unfortunately, we do not know if these measures work. School closures, for example, may reduce transmission rates, but they may also backfire if children socialize anyhow. If school closure leads children to spend more time with susceptible elderly family members, if children at home disrupt their parents' ability to work, and more. School closures may also diminish the chances of developing herd immunity in an age group that is spared serious disease. In other words, children acquiring coronavirus, because they're not susceptible to it the way elderly people are, can develop a herd immunity and therefore stave it off in the future. And now we're preventing that from happening. And the older you get without being exposed to it, the more susceptible to a dire outcome you are. That's a good point. This has been the perspective behind the different stance of the United Kingdom keeping schools open, at least until I write this. Well, he wasn't wrong. The United Kingdom has closed everything now. In the absence of data on the real course of the epidemic, we don't know whether this perspective was brilliant or catastrophic. We don't know. Flattening the curve to avoid overwhelming the health system is conceptually sound in theory, which is why everybody's on lockdown and mandatory shelter-in-place orders and so forth. It's conceptually sound, in theory. A visual that has become viral in media and social media shows how flattening the curve reduces the volume of the epidemic that is above the threshold of what the health system can handle at any moment. Yet, if the health system does become overwhelmed, the majority of the extra deaths may not be due to coronavirus, but to other common diseases and conditions such as heart attacks, strokes, trauma, bleeding, and the like that are not adequately treated. If the level of the epidemic does overwhelm the health system and extreme measures have only modest effectiveness, then flattening the curve may only make things worse. Instead of being overwhelmed during a short acute phase, the health system will remain overwhelmed for a more protracted period. That's another reason we need data about the exact level of the epidemic activity. One of the bottom lines is that we don't know how long social distancing measures and lockdowns can be maintained without major consequences to the economy, society, and mental health. Unpredictable evolutions may ensue, including financial crisis, unrest, civil strife, war, and meltdown of the social fabric. At a minimum, we need unbiased prevalence and incidence data for the evolving infectious load to guide decision-making. In the most pessimistic scenario, which I do not espouse, if the new coronavirus infects 60% of the global population and 1% of the infected people die, that will translate into more than 40 million deaths globally, matching the 1918 influenza pandemic. The vast majority of this hecatomb would be people with limited life expectancies. That's in contrast to 1918, when many young people died. One can only hope that, much like in 1918, life will continue. Conversely, with lockdowns of months, if not years, life largely stops. Short-term and long-term consequences are entirely unknown. And billions, not just millions, but billions of lives may be eventually at stake. If we decide to jump off a cliff, we need some data to inform us about the rationale of such an action and the chances of landing somewhere safe. Boy, that's a mouthful and an ideaful from a man who's not going with what his belly tells him. Where are the journalists asking these questions? Why are articles like this getting almost no attention? Very few people citing this article. Where is this? Let me get this straight. The general the general admonition, really, from the coronavirus experts is that I should be more worried about a potential unreality than I was about statistically provable realities last year, the year before that, heck, even this year. You want me to be worried about what may or may not happen when I'm not worried about what actually is happening? In the case of America, 23,000 estimated flu deaths this year alone, compared to less than 800 from the coronavirus. Again, it's not even close to being close to matching the flu statistics. So when people say this is not just the flu, you're right. Statistically and provably, the flu is much worse. According to the World Health Organization, up to 650,000 people every year die of flu-related illnesses. And right now, the world is shutting down when even Dr. Fauci says we can look at what happened in China and South Korea as a source of hope because it's going down. Fewer reported cases in China than anywhere else. He said, look at Washington. It went up and then it went down. Why should we expect that it's not going to do the same thing anywhere else? These numbers do not correspond to our response. If we didn't shut the United States down when 4,000 Americans were dying every week, How are we shutting the United States down when less than 800 have died in a month? Do you understand that in the same time period the coronavirus has been going? 800 people in a month versus 16,000 people in the same month 2 years ago from the influenza. Imagine that headline. Imagine a headline that read, 4,000 Americans dying every week from a coronavirus. There would be mayhem, as if there's not already. Well, guess what? That was an actual reality 2 years ago, and you didn't bat an eyelash. Life went on. Your TV programs continued. Your sports arenas continued. Bars and restaurants and hospitality continued. Everything continued just as it was. There was just a higher push for you to get that flu shot. 4,000 Americans a week were dying 2 years ago. A week. And if Washington is any indication, if China is any indication, if South Korea is any indication, and according to Dr. Fauci, they are, then there's every reason to believe that this is going to start going down. And when the dust settles and when all this clears and you see that the numbers aren't even close to being close to what the flu does this year or did last year or does every year, then you need to ask yourself, why exactly did we respond this way? And what does this set the stage for? What happens next year when coronavirus 2.0 comes out? Bigger and badder. We just go into lockdown all the time? Again, I say this is unfortunately a fait accompli. We have set the stage for perpetuated fear and perpetuated worry because of this response. And as John Ioannidis rightly points out, we don't know what the long-term effects of this are going to be, not merely economically and socially, but even for the mental health of people. This completely changes the world climate as we know it. And I predict you're going to see the dust settle, and you're going to realize these numbers didn't even come close to seasonal flu numbers because they haven't, and they've had the same time effectively without a vaccine to stop it, by the way. And potentially, if the CDC estimates from 2018 are any indication, they could even be overestimating what we're seeing right now. They've done it before. Remember, they had to alter their statistics by 20,000. They had to drop it 20,000 because they overestimated. Given what has happened in the past, numbers that are provably, statistically, until or unless anything changes, provably worse. And we never responded like this. Why is it that we're responding like this now? Because Dr. Fauci says, look to China. It's already gone downhill. It's only going to last a few weeks. Are you telling me in 3 weeks' time the coronavirus is going to catch up to the global flu rate? There's a total right now. We'll look at this again. Total world deaths, less than 19,000. Are you telling me that in the next few weeks, this number is going to surpass 650,000? Because that's what seasonal flu takes out every year, according to the World Health Organization. As you can see, this is not even on a trajectory to meet that. And an epidemiologist and professor of statistics at Stanford is raising questions that other journalists don't seem inclined to. And for whatever reason, this perspective is not getting the attention that it should. So we don't want to trivialize what is real, and that is people are being affected by the coronavirus. It is real. Many people have died, nearly 19,000 worldwide. But that worldwide number is still less than the CDC's estimates for what's happened in the U.S. alone in the same flu season. And we comprise 4.5% of the world population. So 4.5% of the world's population has already seen more deaths than the entire world has seen from the coronavirus, from the seasonal flu. So when people say this isn't just the flu. I agree. Statistically, the flu is worse. When in doubt, observe and ask questions. When certain, observe at length and ask all the more questions. Now, this is outside of the scope of what is typically covered here. But for the believer in Jesus, this is no cause to worry. Nothing is. That doesn't mean you relish hardship or you relish tribulation. But don't be anxious for it. Jesus said, in the world you will have tribulation. That is promised. It's a promise from Jesus himself. But he said, be of good cheer, I have overcome the world. Prior to that, he says that peace is found in him. So when there is turmoil from without, peace can be found within, assuming Christ is what occupies your within. Will pestilences come in the last days? Yes, the Bible says so. I'm not saying this isn't a pestilence. This is a disease. This is a real disease. What I do want to evaluate, and what we have evaluated, is what the numbers bear out. So pestilences will come in the last days. Real, probably catastrophic pestilences. But if I compare this coronavirus to the seasonal flu, it's not even close to being close. And there's a lot of people tending to worry. And what this professor of statistics and epidemiology says is he's arguably more concerned that our response is going to be more detrimental than the virus itself. And he's probably right. So what do? We don't ground ourselves within what's happening around us. We ground ourselves in Christ, knowing that he is the immovable rock, he is our refuge, and he is our peace. Peace is found in him. So yes, this is a time of uncertainty, but what you can be certain of, and what you're commanded to do, is to cast all your cares upon him because he cares for you, said Peter. Casting all your cares upon him. All of them. Yes, you may have some cares. You may have some concerns. You may be out of work right now. This is unfortunately devastating many people in many different ways, some directly, some indirectly. Some people have lost family members as a result of this. It's tragic. The point is, we need to have the right perspective in order to navigate this new reality that we are unfortunately living in. And our baseline, always our frame of reference, should be Jesus, not the world, not anything else. Jesus is the source of your calm within a storm. So, but we don't want to be ill-informed about things either. You want to pray for wisdom, James says. If any of you lacks wisdom, let him pray to God, who gives to all liberally and without reproach, and do it in faith. Pray for wisdom, because in upcoming months and years, it's going to be necessary. You need to pray for wisdom. And if your faith is weakened, pray that great prayer, Lord, help my unbelief. Because ultimately, you should be firmly rooted in the fact that you are admonished as pilgrims and sojourners in this earth. This world is not your home. Jesus made it clear, my kingdom is not of this world. It's not of this world. And the saints of Jesus look to him and to his kingdom. Thy kingdom come, thy will be done. This is not his kingdom. We are pilgrims in this earth. So, this momentary light affliction, is not worthy to be compared with the glory that awaits us. So put it in its proper perspective as well. No matter how bad it gets, no matter how turbulent, no matter how great the tribulation, Jesus remains the rock and the refuge, the source of peace, the source of hope, the great Amen. Faithful and true is his name. So, until next time, God bless and Godspeed.